Bipolar disorder is a psychiatric disorder affecting an individual's emotions. In this video, a combination of music and dance interprets how emotions are experienced differently by bipolar patients versus people without the disorder. The music represents the emotions experienced, while the dancing represents the effect of the emotions on each individual. The male dancer portrays the intensity of the emotions felt by an individual living without bipolar disorder. And beside him, the female dancer portrays the intensity of the emotions felt by an individual living with bipolar disorder. The music starts off with a bouncy light rhythm and in a major key, indicating a happier time or a higher point in the way someone is feeling. Both of the individuals are feeling a similar emotion, but the intensity and effect of that emotion are entirely different. The male moves to the music. His choreography changes as the music changes. This is similar to how people without bipolar disorder are affected by their emotions. In the minor key, the male experiences a sad or low feeling, while the female experiences depression. Her movements are detailed, and she constantly moves her entire body as each note changes. Every note has an effect on her. She is unstable and completely focused on the sound she is hearing, just as a patient is focused on the way they are feeling. This makes the ability to make logical decisions impossible for bipolar patients without the proper medications or treatment to balance the symptoms. Their emotions have an influence on their actions just as the music influences the male's movements. But the individual isn't entranced in the music. He is still grounded, stable, and relatively consistent. In the major key, the male is experiencing a happy feeling while the female is experiencing euphoria. The female beside him follows a similar choreography. However, she is greatly consumed by the music, just as a person with bipolar disorder is consumed by the emotions they are feeling and experiencing. The most common symptoms of the disorder are mania and depression. Ultimately, these are extremes of the way someone without the disorder would feel when they're happy or sad. The performance of both the male and female give a visual understanding of how deeply and differently they each are affected by the emotions experienced.